Hi, this is Ned Siegfried from Siegfried & Jensen. As proud sponsors of BeliefCast, we hope you are inspired by Todd's weekly podcasts, which contain so many courageous stories of recovery and personal growth. Remember, it's not what happened in the past that matters, it's what happens in the future. We invite you all to work hard and be optimistic about your future. Enjoy today's podcast.
We are back. This is Todd Sylvester with the Todd Sylvester Inspires BeliefCast. Thank you for joining us. I'd like to thank our sponsor, Veracity Networks, and my good friend Drew Peterson. Thank you for believing in me and helping us out in this. I'd like to thank all your listeners once again for tuning in. You guys have been fantastic. The feedback has been overwhelmingly positive, and we have helped so many people with so many different issues. I pinch myself. It's pretty amazing. And it's because of the amazing guests that I have on. Today's no different. Today we're joined by the author of Fallible, a memoir of a young physician's struggles with mental illness, Kyle Bradford. Thank you for joining us.
Yeah, I'm glad to be here. And let me just clarify, Kyle Bradford Jones.
Jones. I forgot the Jones part.
That's all right. I include the Jones because there are so many Joneses, and there are multiple Kyle Joneses around. So
Gotcha.
I got to specify.
Gotcha. No, thanks, Kyle. I appreciate you for being here. You know, Kyle, you've been through a lot in your life. You struggle with anxiety. You went through severe depression. You struggled to try to get your life on track. You even mentioned that you at times you've struggled with perfectionism, like having to be perfect, the demands of your job, being a doctor, and everything that you've gone through. But what I also love what you said is you've worked really hard to put those things in control, because I think you said because your wife and kids deserve it.
Absolutely.
So he's married to his beautiful wife Becky. He's got 4 amazing kids, and you see patients at a clinical program called the Neurobehavior HOME Program, which is exclusively for individuals with a developmental disability, and you're very passionate about working with this population. And then again, your award-winning, best-selling book, and we're going to talk more about that. And again, just with your own struggles with mental illness. But I just want to thank you for taking the time out of your busy schedule to come share your story with us.
No, I'm happy to be here. This is great.
Okay. Well, why don't we start off? Just tell us where you grew up and a little bit about your family life.
Yeah. So I grew up in Farmington, Utah. So it's about 15, 20 minutes north of Salt Lake.
Okay.
And looking back, I think I had pretty much an idyllic childhood. I played Little League. I collected baseball cards. I rode my bike with my friends, and all of those things.
Right.
I am the youngest of 3, so I have an older brother and older sister. And it was just a fun childhood.
Yeah.
I was always kind of an anxious personality, but it wasn't ever a huge issue.
Yeah.
But it was wonderful.
Well, we were talking about how you're a huge baseball fan, Minnesota Twins fan especially, right?
Yes, absolutely.
And then, did that start when you were younger?
Yeah, so my very first baseball memory was in 1987 when the Twins were in the World Series.
Yeah.
And so I was born in Minnesota, which is the connection, but then moved to Utah when I was really small.
Yeah.
And so, that was the only connection I had to a professional team was Minnesota. And, so because of that, I remember my dad getting kind of excited at the World Series. And then in 1991, I was 10 years old, and the Twins won what is considered by many the best World Series ever.
Yeah.
And so for that to happen to a 10-year-old boy,
yeah.
that is like the pinnacle of existence.
Absolutely. Oh, yeah.
I was just so excited, and of course, so nervous during the games, and I would pace around, and my dad would be like, come sit down, knock it off, you're making me nervous. And so much fun.
Yeah. So, and again, you mentioned you were kind of like more of an anxious, maybe more energetic kid, but like you said, it wasn't an issue, and maybe that's, as you got older, maybe it became more of something that you had to look at and concern. We'll get into that in a minute, but you've also you graduated from Medical College of Wisconsin in 2009 with his MD, and then completed a residency in family medicine at the University of Utah in 2012. And again, one of the reasons why I'm pointing this out is that in itself to do something like that. We talk about the demands of life, but the demands of being an MD.
Mm-hmm.
I mean, I'm sure that had to weigh or play a part in a lot of these things that maybe you struggled with.
Absolutely. It was huge. And part of it, it's interesting. So in medicine, there are significantly higher amounts of mental illness among physicians than in the general population.
Really? Okay.
Including substance abuse, suicide, all of these things. And, I've looked and thought so much like, well, what is it? What is different? And part of it, I think, is a selection bias. You have those perfectionists who are more likely to go into medicine. And, when you get to medical school, everyone there has excelled at school.
Right,
and,
right.
They've been at the top of their class or whatever. And all of a sudden, that's not so special.
Yeah, right, yeah.
Everyone's brilliant and everyone's a hard worker and, and everyone wants to succeed. And sometimes it's really cutthroat or whatnot to get ahead. But then you have also just the nature of medicine itself, where, obviously you're dealing with death a lot. You're dealing with suffering.
Sure,
and a lot of the time you have no control over that, but people are coming to you hoping and expecting that.
Right.
And so, obviously you do the best you can. And, there are certainly things we can do with certain conditions, but in the end, everybody dies, of course.
Right.
And you're almost taught that means failure. If your patient dies, that might mean failure.
Yeah, like it reflects on you somehow.
Yeah, exactly.
Right? Yeah.
And, so of course, anyone dies, doesn't matter if you could have done anything else or not.
Right.
It eats at you. And, but also in medicine, we have this funny thing where with the supervising doctors and the students and residents, we beat each other up. We're so mean to each other. That's the culture.
That's interesting.
Yeah. And so there's this thing that we call pimping, where the attending or supervising physician is just berating you constantly with questions. And they're not necessarily to see if you've been studying enough or if you know your stuff.
Mm-hmm.
They are meant to embarrass you and break you down as motivation to work harder.
Okay.
And,
wow.
That doesn't make any sense.
Yeah, it's like, how does that work?
Exactly. And, oftentimes they'll do it in front of patients or in front of colleagues or nurses or, whoever. And, it just eats at you so much. And so you got all of these things kind of coming together and coalescing. And, when you look at it like that, I'm not surprised there's a higher level of mental illness.
Yeah, and all those things. So, and thanks for sharing that. And that's interesting. I didn't really realize that. And maybe a lot of people don't know that. Going back, you said you struggled with being, feeling like I got to be perfect.
Mm-hmm.
Did you notice that when you were little? Was it like you even noticed it as a kid? Like you were always trying to be like you said, perfect.
Yeah, I did. And, I always wanted perfect grades. I never wanted anyone to be mad at me and, just little things like that. If someone was upset with me, boy, that just crushed me. So yeah, there was always kind of an element of that. And, I think that's a lot where the anxiety started to slowly build as a kid and then into teenage years. And then it kind of came to a head in my 20s as I was preparing for medical school. And it was one of those things where you constantly hear, nobody gets into medical school. It's so hard. You have to do so many things.
Yeah.
And so I'm working my tail off, going to school and working and volunteering, doing research and all these things that they expect you to do. And, but I'm still worried that that's not enough.
Right.
That that no matter what I do, I won't be able to make it.
Gotcha.
And so it just...
How old were you when you made the decision, I want to be a doctor?
I was probably 16 or 17.
Okay.
It was funny because no one in my family is in the medical field at all. And so it never really crossed my mind. And then when I was a teenager, my mother had breast cancer. And so, she would go to her primary care physician and her oncologist and her surgeon and all of these different appointments. And then when she came home after those appointments, I could tell exactly what type of doctor she saw, because, no matter what treatment was possible or available, if she saw a doctor who cared for her as a person and connected with her, she came back hopeful. And if, there were a couple of times she saw a doctor who was not that way, and I think we've all, hopefully not all, but I think all of us have experienced physicians who don't have a very good bedside manner.
Right.
And so I saw the impact of that on her.
Oh,
and so that was
wow.
really inspiring to me, of like, my goodness, like the treatment doesn't change no matter which of these doctors she sees, but she changes.
Wow.
And, and that hit me hard. And I thought, I want to be a part of that.
Wow, that's powerful.
Yeah.
Yeah, seeing how just the way we treat someone, like the way, with respect and love and care and compassion, what that does.
Mm-hmm.
Like that's almost the best medicine almost, right? We hear that a lot, right?
Yeah, absolutely.
No, thanks for sharing that. I think that's one of those powerful things. So obviously being a doctor is no easy thing. You just mentioned that. And you being the perfectionist, is this when you started having really struggles because you went through severe depression and anxiety and things like that? Talk about that part of your story and how that played a factor in everything moving forward for you.
Yeah. So as I mentioned, the anxiety kind of slowly built, I think, throughout my life. And I don't think it was, like I said, I don't think it was anything in my teenage years or anything that was clinical or to that extent.
Okay.
I went on a mission for the Church of Jesus Christ of Latter-day Saints to Ukraine. And so from the ages of 19 to 21, I'm in a part of the world where it's always gray. There's just this history and culture of depression.
Right, yeah. You just feel it. Right?
Exactly.
Yeah, it's just there.
And
it feels like,
it was part of that perfectionism thing too, of like, okay, well, I'm here, my job here is to serve people, but if I'm not giving everything I have, then I'm wasting my time, I'm wasting their time,
right.
I'm going to fail.
Yeah.
And so, it continued to build during that time. And then coming home and being an undergrad and, like I said, the classes and working and everything, it just came to a head. And so I was working at a group home for individuals with severe mental illness and disabilities. And I was working a night shift. And so, it's the middle of the night. It's probably 2 or 3 in the morning. Everyone's asleep. It's quiet. And all of a sudden I have a panic attack, which I've never had before. So my heart's pounding like crazy. You kind of get that impending sense of doom and just this extreme anxiety and it's terrifying. You think you're going to die.
Right.
And so, but I was like, I couldn't leave because I had to stay there to make sure everyone was okay. And, so the next day I go to the doctor and I was like, I have a problem with my heart because, my heart was beating like crazy. I thought it was a heart issue. And so I describe it to him and he's like, no, I think that's anxiety. And it just kind of floored me. I thought, really?
You're like, what?
Yeah. And I wasn't, sometimes you hear that and you're like, no, that can't be true. I didn't have that response. It was just shocking. Like, oh, I never thought of that. But,
yeah, right.
But yeah, I could see that. And so, ended up seeing therapists and getting on medication and whatnot. Then, fast forward about 7 or 8 years when I'm in residency and we're working 80 hours a week, but it's, you're working 30-hour shifts and, your schedule's constantly being thrown all over the place. And I just got hit with this awful depression, and it was just so hard to get out of bed in the morning. Part of it, I think, was the circumstances of residency. Part of it was the disrupted sleep. Part of it was, I felt guilty that I never saw my family. At the time, I had 2 young boys, and during residency, we had our 3rd child. Oh, wow. And, and so I'm feeling guilty. I can't help my wife. And, I come home in the day and all my small boys want to do is wrestle and play, and I can't stay awake to do it. And
you're exhausted.
Exactly. Just all these things. And it just got really bad. And so then I had to, kind of pursue, I was still on medications, but had to, look at other options and different things and start going to therapy again and all of that.
Did you ever have thoughts of suicide or cause when you get to that overwhelming, you were a lot going on. You're trying to raise a family at the same time, doing all this other stuff, but yet going through this depression piece. I would imagine maybe you had some of those thoughts at that time. Or?
Yeah, I had kind of some passive suicidal thoughts. Okay. So I'm driving to work and it's like, man, it'd just be easier if I ran into that pole and was seriously injured and I didn't have to go to work, or, I could just hang out at the hospital and take time off being sick, or injured or dead or whatever. So I never had a plan or anything like that, but had those thoughts a lot of it might just be better off if I were dead.
Yeah. I think that's more common than we think with people, and people hearing this right now are probably I can relate with that kind of thing. And so, so you're going through this. What was your wife's response to all this? Becky's response? How was she handling seeing you where you were at?
Understandably, she was struggling as well. And each time we had a child, we didn't quite realize it at the time, but looking back, she definitely had some postpartum depression. Mm-hmm. And with, two of our kids were born in the winter. So of course you've got the depression and it's cold and you can't go outside and, it might be grayer skies. And then the other two were born in the summer, but then by the time winter hit, they're 6 months old and now they're moving around and, causing other issues. And so, there was that seasonal, affective disorder part of it. In the book, we talk about how she, during med school, when I was struggling and she was having some of the seasonal depression, and she would start banging her head against the wall and,
really?
Really hard, not just, soft things and just different things like that. And, she said, well, it just kind of relieved the pressure a little bit, for whatever reason, it just kind of felt good.
Yeah.
And so, that she's struggling, but she still has to be there and be the mom. And, she worked through part of that. And, it was kind of a mixed blessing because it was good to get her out of the house and doing something else. But then it was also one more thing she had to do. And
wow.
And so, it's one of those things where no matter who in the family struggles with any sort of mental illness, it's basically a family disease. It affects everybody.
Right. Everyone's involved in it, and it spills out over everything. Did you notice, it even spilling over to your kids? Were they noticing things? I mean, I know they were younger or whatever, but did you see that as well?
They, looking back, I knew, so I've always kind of had a short temper and looking back, with small kids, it can be easy to get frustrated and upset. Yeah. And so, they do remember me getting angry a lot and things. Right. And we've talked a lot about it since. And, I've gotten a lot better as things have been treated and whatnot. And they recognize that those things have improved, but they remember Dad at his worst.
Well, I want to get into that with things that you've done to really help you in these areas, but also you mentioned your book. Mm-hmm. Let's talk about the book. What's the book's purpose? Why did you write it? Why did you decide to go this route?
There's a couple of reasons. First, the main reason is trying to decrease stigma, because obviously that's a big thing right now. Yeah. Where, we just beat ourselves up if not even if a perfectionism thing, but we think, boy, I can't have a mental illness,
right, that's taboo almost.
Yeah.
I can't even talk about it.
Yeah. When my parents were growing up, someone with mental illness was the homeless guy muttering to himself with schizophrenia. That's what mental illness was. Mm-hmm. And I'm not that, so it can't be an issue. And so part of it was to decrease that stigma among physicians because, that perfectionism, that Superman complex, like, the God complex.
Yeah, we hear that a lot, honestly.
Yeah.
I can't be hurting at all because this is who I'm a doctor.
Exactly.
Of thing, right?
Yeah. And so, that was part of it, because if you have untreated depression or anxiety or substance abuse, you are much more likely to make medical errors and harm patients. And so a lot of doctors either don't want to admit that they're struggling, or if they do recognize it, they don't necessarily want to get treatment, but because they're afraid it's going to hurt their livelihood and
Right.
whatnot. But I think the opposite is even more true, that if you keep doing what you're doing with an untreated mental illness, you're going to cause a lot more problems for others and for yourself.
Wow.
So that was a big thing, stigma amongst medical professionals, but then also the general population, with
Right.
doctors are obviously looked up to and in society and whatnot. And so, things like having someone who has been successful and say, yeah, I've struggled. It's been that much harder to get where I am. I think that helps people too.
Right.
That helps us
Great.
feel better about things.
So how has the feedback been? Because again, you not only talk about just in the general public, but you even get more specific with physicians and doctors and everyone that is struggling with it even more so.
Yeah.
How has the feedback been among your peers?
It's been very positive, because I feel like maybe the last 5 to 10 years there kind of has been more momentum to being a little more open and being okay with it.
Because you're kind of like pioneering that. I mean, because like you said, they don't normally talk about this, especially in your field, right?
Yeah.
So here you are, like, I'm putting it out there. That's why I was asking, why did you go this route? But I'm understanding more of why you're doing this.
Yeah. And so I've had a lot of groups, whether they're residencies or med schools or even practicing physicians, where they want me to come talk to them and share it. And even a few months ago, we had the Department of Surgery at the University of Utah wanted me to come talk. That's huge for surgeons to want to talk about this.
Yeah.
And I thought, okay, this is having an impact.
Dude, totally. That's amazing.
Yeah.
That's great. You mentioned, I'm just reading on here, nearly 1 in 5 Americans deal with mental illness in a given year, and the rates are climbing. Among physicians, the rate is even higher, as the time spent in medical training significantly increases the risk of poor mental health.
Mm-hmm.
Is there something that you're doing too, that maybe even the book goes into about helping that particular area with, is there certain things that you can do going through, medical school and things like that?
Yeah, I've had the privilege of mentoring a lot of students and residents
Great.
as they struggle with that. And really, it's so funny, because giving them kind of permission to talk, first of all, and be open about it, but then also permission to not be perfect. I mean, those two things make a huge difference.
Yeah.
And so, when I once a week, I supervise family medicine residents in their clinic when they're seeing patients. And so every time I'm there, and, we have like 30 different residents. And so it's a few, it's different ones each time.
Right.
And just sincerely asking, how are you doing? And how are things going?
Yeah.
It like opens the floodgates sometimes. It's like, oh, I can talk about this. And you obviously what it's like.
Yeah. For sure.
and that doesn't
Yeah.
obviously fix the underlying issues, but it really does make it so much easier to be able to deal with the stressors.
Right. Absolutely. Well, I know when I've sat with a doctor, for an appointment here or there, the ones that do show that compassion, hey, I want to hear what's really going on with you. Like, how are you doing overall? And they really want to know about me.
Yeah.
It really does make the experience completely different.
Yeah.
Versus, like you said, the other doctor who doesn't do that, they're all saying the same thing of what we need to, work on or to take to heal ourselves. But it's amazing the difference that you walk out of there with, and just that positive mindset, I think, helps a ton for the patient. But I would imagine when a doctor's doing that and giving away that positivity, it probably helps the doctor at the same time. Would you agree with that?
Absolutely. And that's one of the reasons I went into family medicine was, we look at the whole person. And and so, you have diabetes, but instead of focusing on, hey, your sugars are out of control, it's okay, well, why? Tell me what's going on. There's more to it. What's going on in your life that is impacting this. And then you have those long-term relationships too. And so having those things in a specialty, like I knew I needed that to be able to communicate on a personal level.
Okay, great. Wow. So we mentioned there just a minute ago about there's some certain things you started doing because we mentioned you worked really hard to kind of put those things in check, the depression, the anxiety, the perfectionism, all of that, because you felt like, hey, my wife, my kids deserve it. You deserve it. Yeah. What did you do? Let's talk about that. And how did you learn these things that you did to help yourself out there?
First of all, I did, I have engaged in therapy for years. I have a therapist currently, even, things are going great, but I still check in with her. I need to keep that up. Yeah. I have been on medication since 2003. And, from time to time, you need to adjust that or find something that works right. But even more than that, it's kind of the mindset of, you know what, I deserve to be happy. I deserve to feel good and be able to function.
Like that.
And like you mentioned earlier, my family deserves that too. Right. My kids don't deserve a dad who comes home and he just yells all the time. Right. They deserve someone who loves them and who is going to connect with them. And so my mantra has become allow yourself some grace. Because one of the biggest things with depression and anxiety is guilt. You feel that guilt for not being better or for letting people down or whatever it is. And you know what? Stuff happens. We're human. Allow yourself some grace. Forgive yourself.
I like that.
Yeah, that's so important. And so it would be little things like I hope my supervisors when I was residency aren't listening because every once in a while I would just take a day off.
Yeah.
And so I would be on a rotation with some doctor and I would just call in sick or whatever and just do whatever I needed to that day for myself. And obviously you can only do that to a certain extent. It's not like you can do that all the time, but every once in a while, I think you need that.
Yeah.
And so, just little things like that.
Like taking time for yourself.
Yeah.
Right. It's, and I get what you're saying. I think anyone listening to this has probably done the same thing in their own job.
Yeah.
Where I'm just taking a sick day, personal day, because I just need to get away for a minute.
Yeah.
And just do nothing. Right.
Yeah, absolutely. And there are all those things where we know that focusing on a good diet, exercising regularly, all of those things really make a big difference in your mental health. And I've had periods where I've done better with that than others and whatnot, but I definitely can tell a difference, if I'm trying to work on those things.
Yeah, it's interesting. So in the world I'm in, addiction recovery, I work with a lot of clients who are here at Wasatch where they're here because of a drug addiction or alcoholism and a big part of our program here is exercise and diet. We teach them to eat more healthy. They go exercise every single day. And just that alone, if you just did those two, it's amazing what that will do for your overall happiness and mental health,
Yeah, absolutely. And it's one of those things where it's kind of like when your doctor tells you, well, you need to exercise more healthy. You're like, yeah, I know, I get it. And
yeah, thanks. Yeah.
Yeah. But then once you actually do it, it really does make a difference.
Right.
Getting to that point can be difficult, especially if you're in the midst of depression and you can't motivate yourself or whatnot. But you know what? Every little thing counts. I always tell my patients that if you're not exercising now, just walk around the block, once a week for a couple weeks and then build on that. Every tiny little thing helps.
Yeah. I love that. So what, do you have like a like a daily routine that you try to follow? I mean, is there a certain routine you like to do, and what does a day look like for you?
A day with work is it's hard because I'm in academics, and so about half my time is clinic and seeing patients, and the other half is working with students and residents and and some research and things like that. And so it kind of varies by the day.
Sure, yeah.
However, I always make sure I have at least a few minutes over lunch. First of all, to eat lunch, which sometimes all of us, and especially doctors, we don't take time for that.
Yeah.
But also, I want to go for a short walk over lunch if I can, and just, even if it's cold and gray outside, I still need that fresh air. I need to move around a little bit, and that makes a big difference for me.
Yeah.
And then, when I come home, I try to spend at least a little bit of time with my kids as much as possible.
Right.
My oldest is 16 and my second is 13, and so they have a lot of activities in the evenings or whatnot. But my girls, who are 5 and 10, they love to wrestle on the bed. So they always want to, Dad, can we wrestle on the bed? And what that means is usually I pick them up and toss them on the bed. That's what they want.
Yeah, exactly. Yeah.
And so, I try to do something like that to make that connection.
Again, the little things you're saying.
Exactly.
Right.
Exactly. So, another thing that, certainly I don't do this every day, but one thing that's really therapeutic for me are jigsaw puzzles. I really like doing puzzles.
Okay.
And I read an article maybe a month or two ago by a psychologist who said that is probably one of the best things that have helped many people through the COVID pandemic, because it's taking chaos and putting order to it.
Wow.
And so it kind of helps your mind kind of do that in other areas. And I thought, well, that's fascinating. That makes sense. Maybe that's why I like it so much.
Maybe.
But
get you to laser focus on, forget everything that's going on around you, and you're just right here with this puzzle.
Yeah. And it starts out with all these pieces everywhere. It's chaos, but the goal is to put it together and create this organized picture of whatever. And I love that. I thought, that helps shape my thinking and how I'm approaching things.
Yeah. It reminds me of the principle, what you focus on increases. So if you're focusing on the puzzle, that's you're there, like you just said, you get to create this puzzle out of this mess.
Yeah.
But that's your focus. You're not worried about, well, COVID's going on, there's a pandemic.
Yeah.
It seems like the world's falling apart,
Yeah.
and that can be overwhelming, right? And so I think routine's important, and I like what you said. It doesn't have to be something big or fancy, or it's just those little things. Just even taking a little time throwing your girls on the bed, and just that little thing can go so far.
Yeah. Yeah. No kidding.
So you're currently the family physician and associate professor in Family and Preventive Medicine at the University of Utah Medicine.
Mm-hmm.
That's a big role.
Yeah.
I mean, does that add, is that something that puts pressure on you knowing that you're in that position, or is that or are you kind of beyond that? That doesn't necessarily put pressure on you. I'm just curious because, looking from the outside, to me, I'm like, man, that's a big role, big thing to do there.
I'll answer with my wife's favorite thing. Yes and no. She hates it when I say that. So yes and no. It does add added pressure in that, with academics, no matter what field, it's okay. Did you publish a paper this month, or did you do this or whatnot? and I've kind of decided, I enjoy doing those things, but I'm not going to give myself a quota, or I'm not going to force it.
I like that.
And I'm not going to lose my job. Maybe that means I don't get a promotion as quick or whatnot, but I'm okay with that.
Yeah.
Or things like, seeing patients is tough, and it wears on you in a lot of different ways, kind of for some of the reasons I mentioned earlier.
Yeah.
And so even though I only see them with half of my time, that can still be a lot of pressure. But that's partially why I'm in academics, is so that I can kind of diversify.
To break it up a little bit.
Yeah. And help patients in other ways, like with training the residents or working with med students or things like that. And so, but overall, at this point, I'm happy that I'm an associate professor and I'm doing these things, but I'm not going to kill myself to get to the next level.
No, I gotcha. Again, kind of trying to have some form of balance through all of this.
Yeah.
Right?
Yeah, absolutely. And even if that means, okay, well, maybe I'm not going to be full time, or, maybe I'm not going to go for that new opening position that, theoretically someone else may think I should.
Right.
I'm not going to do that if that's not going to work for me.
Right. Well, so how has your religious background and maybe your faith helped you through all of this?
It's interesting because, so I have a chapter in the book where I kind of dive into the role of religion and mental illness, because some people see it as a huge hindrance to mental well-being, and others see it the exact opposte, that it's a huge support.
Yeah.
And I've experienced both at different times. And so there is the kind of the research that's been done ultimately shows that it depends on how you view God. So if you view God as this mean, terrible, punishing being that is only there to try to punish you if you don't do everything right, that has a huge negative impact on your mental health.
Wow.
And if it's the opposite, where you see God as a savior, as someone who's there to help you, as supportive and loving, then it can actually be very supportive to your mental health. And
I've never heard it said that way. I love that.
Yeah, it makes
powerful.
so much sense,
it
right?
It does when you say it, I'm like, duh.
Yeah.
But anyway, that just really hit me hard. Thanks for sharing it that way.
Yeah, and it's interesting because, being a member of the Church of Jesus Christ of Latter-day Saints, or a Christian broadly, a lot of people do have that view of the angry, punishing God, but it's not necessarily based in scripture or doctrine. It's just kind of a cultural interpretation.
Right.
And so, really focusing on, well, actually, this is what is really being taught of Jesus as Savior and the loving older brother and those things. When I focus on that really does help and is a huge support to me.
Yeah, I would imagine so. And again, I know, I can imagine how that could go either way, especially in the profession you're in. And I know some people view it as a, stay away, don't talk about that, versus no, this is everything, every bit a part of my healing process is my faith and my religious background, or whatever it may be.
Yeah.
Whatever you might believe in.
And it's so interesting, some of the feedback of the book, when people read that part, if they do believe in God, they say, oh yeah, it helped him. It was, religion was a good thing. And if they don't, or they aren't supportive of religion, they have the opposite of it, like, oh, see, it was negative for him. I think that's fascinating.
It is fascinating, yeah.
You're kind of picking out what your own view is. Since I kind of experienced both, that's what you're choosing to focus on when you read it. I thought that was very interesting too.
That's fascinating. That's awesome. Fallible, a memoir of a young physician's struggles with mental illness. Where would they find this book if someone wants to get this and read this? You can get it on Amazon. You can go to my website, kylebradfordjones.com, and it has links to all sorts of different places you can get it, including from the publisher. If a lot of people want to support. It's an indie publisher or indie bookstores that are near you. There is a link there where you can find your local independent bookstore. So any of those ways you can get it. I love it. So what has been the biggest surprise in being a doctor? I know this is a big question because you've probably had many.
Yeah.
But being going through the whole process, even the process in itself, did anything surprise you? Did you surprise yourself? I don't know. Do you sometimes go, man, I'm a doctor?
Yeah, sometimes I do. Where did that come from? How did this happen? I think I was surprised in that during residency, in the midst of my depression, I honestly felt like I was losing my humanity.
Mm.
And that was a huge shock. I did not expect that.
Yeah.
And, there's studies of when students enter medical school, and they have these huge levels of altruism and, kind of the cliched answer to medical school interviews of why do you want to be a doctor is, well, I want to help people, but you honestly feel that you're going into it for that reason. By the time you're in your third year of med school, that's almost completely gone by most students.
Really? Okay.
Which, it kind of beats it out of you, so to speak, for lots of different reasons. And so, losing, I always did, that's why I went into it, like the story with my mom. I wanted to be that supportive physician, but I was just so tired physically and emotionally and spiritually and everything that I didn't think I could do that.
Yeah.
And so that's partially why I ended up working at this clinic with individuals with developmental disabilities, because it was, in the book, I basically say I wasn't sure if I took the job to prove to myself that I hadn't lost my humanity or in order to regain it.
Interesting.
And because I knew, it's an underserved population. Right. A lot of people are very uncomfortable around a lot of people in this population, and it was a need, and I needed to fill a need, so to speak.
I gotcha.
And so it's been great. Like, it's absolutely been the best move for me.
Yeah.
And obviously it's more challenging in ways, but also more rewarding in others. And so kind of all of those things together, whether you could say I did lose my humanity or not, but the struggles I went through and then kind of coming out the other side and being able to be successful in all my different areas of life and whatnot,
right.
Has been huge and has really probably been the biggest surprise.
Wow.
The ups and downs and where I am now.
No, I love it. Very well said. Thank you for sharing that. If there's someone listening to you right now, Kyle, who's struggling, they're going through mental illness, I mean, you've already given some good advice and things that you've been doing. What would you say to them right now if they're in that maybe that dark place and, and maybe a challenge you could give our listeners?
Absolutely. I would say allow yourself some grace,
Back to the
my
grace
mantra.
thing,
Yeah.
I love it.
And, find a way to do that. And that can look a lot different for different people, and that's okay. Whether it's simply just kind of accepting that, I'm not going to get a 100% on every test, or, I am going to get angry every once in a while, or there will be days when I miss my workout, and, and that's okay. Just being able to allow yourself that grace, you know, that's big.
Yeah. It's hard to argue with that.
Yeah, sure. Sure.
No, that's awesome. Well, thank you for sharing that. If someone wants to reach out to you and ask you a question or get to learn more about you, do they just go to your website?
Yeah.
Is that the best place?
They can go to my website. I'm on Twitter and Facebook and Instagram, which is at KBJones11, all three of those.
Okay.
But yeah, the website, KyleBradfordJones.com.
Yeah, it's not just Kyle Bradford.
Correct.
Add the Jones. Talk about being perfect. I want to be perfect for this interview with you. And I forget to say the last name of you.
You know what? And it's okay.
It's okay.
Yeah,
and I told you we wouldn't
went
edit.
just fine.
Yeah. So, and thanks for, forgiving me. No, you're wonderful, Kyle. Thank you for coming today. And I know you're a busy man and that you were willing to come to the studio here, so to speak, and share your story with us. And props to you for being willing to write a book
Thanks.
that really talks about, especially in your field where you don't talk about mental illness. It's almost like taboo. And you're kind of paving the way like, hey, let's open up and talk about this. And so props to you on that. Thanks for doing that.
Thank you. I appreciate that.
Yeah, you're awesome. Well, there you go, folks. Kyle Bradford Jones. I almost said Jones Bradford. Geez, I'm really having a hard time here. But no, thank you for tuning in. Please reach out to Kyle. Get his book. It's not just for physicians and doctors, and it's for everybody. And everybody on some level goes through some mental illness issues. And so this would be a great book for you guys to pick up. Reach out to him, send him a note, tell him thanks for being on and what have you. But again, Kyle, thank you for being here today.
That was my pleasure. Thanks for having me.
You betcha. Okay, guys, well, till next time, tune in and then share this podcast, this Belief Cast, with everyone that you know that may need to hear this. And thank you for believing in me and tuning in week after week. So till next time, thank you.